Hi, my name is Lexie Perkins. I'm a fourth year HSM major and a first year MHA major at the School of Public Health. I had the opportunity this semester of interning with adaptive nursing out of Greenwood, Indiana, and I'm here today to share that experience with you. Adaptive Nursing is a fully licensed home health company specializing in long-term in-home care to patients with significant medical needs. Our job is to staff clients with excellent caregivers who can help them with activities of daily living like personal care, meal preparation and assistance with feeding, light housekeeping, medication reminders, safety and supervision, and consistent oversight from our registered nurses. Adaptive's mission is to positively impact as many lives as possible through the delivery of exceptional home care services, and I get to see that effort being made every day in the office. They're a local veteran-owned Indiana-based business with their headquarters out of Jefferson, Indiana. Now with over 20 offices across the state, they're able to provide services to every county and client in Indiana. We're here at the office and I'm just going to give you guys a little tour of what it looks like and where we work every day and the great people here. As you can see, this is where you walk in. That's the front desk, and that's Emma, who's the personnel specialist, where you can ask any HR related questions. I work with 3 other program managers on a daily basis dealing with client schedules and getting caregivers hired to meet the demands of our clients. Here is a picture of the client's open schedules that still need staffed. So the office keeps track of who needs staffing by the names on this board and having that available to glance up at every day to see what they need to still get done, who they still need to get staffed for the day, and who potentially we could hire to fill those positions. Here are some of the responsibilities I was tasked with while interning at Adaptive. My main responsibility, though, was assisting with the hiring process. I acted as the hiring manager, conducting interviews over the phone, as well as helping with next steps of the hiring process. Other projects I worked on while there were ways to how to increase employee retention and making more of an effort in taking steps to recognize excellent caregivers and clients. I was also given opportunities to learn about program manager roles and how they problem solve and staff the ever-growing number of clients in the area. This is the room where we conduct our interviews. We're currently doing them over the phone because of COVID reasons. We range anywhere from 5 to 15 applicants a day, and I'll either go through a series of questions with them over the phone or I'll leave them a voicemail where they can call back and schedule an interview over the phone. I use 3 different papers to conduct my interview process. I first start with this paper just asking basic questions, and then once they qualify for the position, we then move on to the interview paper. Once we go through the interview portion, I then go over a skills checklist to see what kind of skills they have experience doing and what kind of clients we would be able to put them with. Prior to this experience, I actually had the opportunity to work as a home health aide, and during the hiring process, I kept in mind the traits and qualities I found necessary to being a home health aide, those being patience and dependability. So during my time at Adaptive, I was really happy that I was given the opportunity to go out with the other program managers into the community and visit clients' homes to thank them for their patience, but also to recognize our excellent caregivers for all the hard work they've put in and the efforts they've made to keeping our clients safe during these difficult times. So what skills did I learn while at Adaptive? During my time there, I learned various communication methods through over-the-phone interviews, communicating with program managers about pairing new hires with clients that need staffed, and organization-wide communications for daily operations. I got to observe firsthand the roles of personnel specialists and program managers, learning various techniques for employee retention and employee recognition. I developed my problem-solving skills dealing with staff calling off and needing to find clients' replacements for the day. I learned about Medicare compliance and prior authorizations, as well as how their Medicare reimbursement works, and learned about how to work alongside a health pandemic and dealing with COVID compliance. The hiring process had to be tweaked, so it was neat seeing how they conduct the interview process in this new setting. My favorite thing that I learned, though, was the understanding overall structure of a long-term home health organization. I got to see and help firsthand with operational summaries, as well as began to comprehend what all goes into a larger organization. The team was very helpful in answering any questions I had and helped me to learn how a home health company runs alongside its many other organizations. Throughout my internship experience, I was constantly finding connections of things I've learned in the classroom and seeing them put to use in the real world, whether that be how to work with a team, communication skills, leadership skills, finance skills, and process improvement strategies. Overall, I really enjoyed my time at Adaptive and have come to love the company and what they stand for. They strive to positively impact as many lives as possible on a daily basis, helping those that truly do need help. And they have a great work culture, always uplifting others and showing appreciation where deserved. Because of having the opportunity at Adaptive, I have now been given more of an idea to what I will value in a career and what I'll look for when job searching. I've always saw myself working in a big corporate hospital, but now that I've gotten to see multiple perspectives of healthcare, it reminds me to keep my options open for the future.